Nursing interview questions and answers. 1. Why did you choose nursing as a career? Answer: Nursing provides a unique opportunity to make a positive impact on people's lives. Nursing is also a challenging profession that requires critical thinking and problem-solving skills, which I find appealing. 2. What experience do you have in nursing? Answer: I have completed my nursing education and clinical training, and I have worked as a nurse in a hospital setting for the past 2 years. During this time, I have gained experience in administering medication, wound care, patient education, and collaborating with other healthcare professionals to provide comprehensive care. 3. What are your strengths as a nurse? Answer: I believe my strengths as a nurse include excellent communication and interpersonal skills, attention to detail, and the ability to remain calm and composed in stressful situations. I also have strong critical thinking and problem-solving skills, which enable me to assess patient needs and develop effective care plans. 4. How do you handle difficult patients or family members? Answer: I believe that empathy and understanding are critical when dealing with difficult patients or family members. I always try to listen carefully to their concerns and provide clear explanations and reassurance. I also involve other healthcare professionals, such as social workers or chaplains, as needed to help address any underlying issues. 5. Can you tell us about a time when you went above and beyond for a patient? Answer: One example of when I went above and beyond for a patient was when I noticed a patient was feeling lonely and isolated during their hospital stay. I took the time to sit and chat with them, and I also arranged for a volunteer to visit and spend time with them regularly. This helped to improve the patient's mood and overall well-being, and they were grateful for the extra attention and care. 6. How do you prioritize patient care tasks? Answer: I prioritize patient care tasks based on the urgency of the situation and the patient's needs. I also consider the complexity of the task and how much time it will take to complete. In some cases, I may need to delegate tasks to other members of the healthcare team to ensure that all patients receive timely and appropriate care. 7. How do you handle stress in the workplace? Answer: I handle stress in the workplace by prioritizing my workload and taking breaks when needed to recharge. I also try to maintain a positive attitude and seek support from my colleagues and supervisors when necessary. Additionally, I practice self-care by exercising regularly and engaging in activities outside of work that help me relax and unwind. 8. What are your weaknesses as a nurse? Answer: One weakness I have identified is that I tend to be a perfectionist and can sometimes get bogged down in details. However, I am aware of this tendency and have developed strategies to help me stay focused on the bigger picture and prioritize my workload effectively. 9. How do you ensure patient confidentiality and privacy? Answer: I ensure patient confidentiality and privacy by following all relevant policies and regulations, such as HIPAA. I only share patient information with authorized healthcare professionals who have a need to know, and I always obtain informed consent from patients before sharing any information. I also make sure to store patient records securely and dispose of them properly when no longer needed. 10. How do you stay current with new developments in nursing and healthcare? Answer: I stay current with new developments in nursing and healthcare by attending conferences, workshops, and seminars. I also read professional journals and stay up to date on current research and best practices. Additionally, I collaborate with other healthcare professionals to share knowledge and stay informed of new developments. 11. Can you describe your experience working with electronic health records, EHRs? Answer: I have extensive experience working with electronic health records, EHRs, and am comfortable using a variety of different EHR systems. I understand the importance of maintaining accurate and up-to-date patient records, and have developed strong data entry and management skills. I also appreciate the benefits that EHRs offer in terms of improving patient safety, efficiency, and communication among healthcare professionals. 12. How do you handle conflicts with coworkers or other members of the healthcare team? Answer: I believe that open communication and collaboration are key to resolving conflicts in the workplace. If I have a disagreement with a coworker or other healthcare team member, I try to approach them calmly and respectfully to discuss the issue and find a solution that benefits everyone. I also seek guidance from my supervisor if needed and am willing to compromise or negotiate to reach a resolution. 13. Can you describe a time when you had to make a difficult decision regarding patient care? Answer: One difficult decision I had to make regarding patient care was when I noticed a patient was experiencing a significant amount of pain but had a history of substance abuse. I had to balance the patient's need for pain management with the potential risks of prescribing opioid medications. After consulting with the patient's healthcare team and considering all available options, we decided to start with a lower dose of opioids and closely monitor the patient's response. This allowed us to manage the patient's pain effectively while minimizing the risk of addiction or other adverse effects. 14. How do you ensure patient safety in your practice? Answer: I ensure patient safety in my practice by following all relevant policies and procedures, such as hand hygiene, infection control, and medication administration protocols. I also conduct regular patient assessments and monitor vital signs to identify any changes in the patient's condition that may require immediate intervention. Additionally, I take a proactive approach to prevent falls, pressure ulcers, and other adverse events by assessing the patient's risk factors and implementing appropriate interventions. 15. Can you describe a time when you had to provide care for a patient with a cultural or linguistic difference? Answer: One example of providing care for a patient with a cultural or linguistic difference was when I cared for a patient who spoke very little English. I made sure to provide written instructions and use visual aids to explain procedures and medication instructions. I also enlisted the help of a professional interpreter and provided access to resources such as translated materials and cultural brochures to help the patient feel more comfortable and informed. By taking these steps, we were able to provide effective and culturally sensitive care for the patient. 16. Can you describe a time when you had to provide care for a patient who was uncooperative or noncompliant? Answer: One example of providing care for a patient who was uncooperative was when I cared for a patient who refused to take their medications. I took a patient-centered approach and tried to understand the patient's concerns and reasons for refusing. I provided education about the importance of taking the medications as prescribed and listened to the patient's feedback to identify any possible alternatives or solutions. I also involved the patient's healthcare team in the discussion to ensure a coordinated and collaborative approach to care. 17. How do you prioritize your tasks and responsibilities as a nurse? Answer: As a nurse, I prioritize my tasks and responsibilities by assessing the patient's needs and identifying any urgent or high-priority tasks that require immediate attention. I also use critical thinking and clinical judgment to determine which tasks are most important and allocate my time and resources accordingly. Additionally, I communicate effectively with my colleagues and healthcare team to ensure that we are all working together to provide the best possible care for our patients. 18. Can you describe a time when you had to respond to a medical emergency? Answer: One example of responding to a medical emergency was when I cared for a patient who experienced a cardiac arrest. I immediately initiated CPR and called for assistance from the healthcare team. I provided clear and concise communication to the team about the patient's condition and worked together with them to administer life-saving interventions such as defibrillation and medication administration. By staying calm, focused, and working together as a team, we were able to stabilize the patient and provide the necessary care. 19. How do you ensure that you maintain accurate and up-to-date documentation? Answer: I ensure that I maintain accurate and up-to-date documentation by adhering to best practices and following all relevant policies and regulations. I make sure to document all care and interventions provided to the patient in a timely and thorough manner, using clear and concise language. I also double-check my documentation for accuracy and completeness and seek feedback from my colleagues or supervisor when necessary. 20. How do you approach patient education and discharge planning? Answer: I approach patient education and discharge planning by providing clear and concise information to the patient and their family members, using appropriate language and visual aids as needed. I also take the time to assess the patient's understanding of their condition, treatment plan, and medication instructions, and provide opportunities for them to ask questions or seek clarification. In terms of discharge planning, I work collaboratively with the healthcare team to ensure that the patient has access to the necessary resources and support systems to facilitate a safe and smooth transition to their next level of care. 21. Can you describe a time when you had to work with a difficult patient or family member? Answer: One example of working with a difficult patient or family member was when I cared for a patient who was resistant to following their treatment plan and had a family member who was frequently confrontational and demanding. I approached the situation with empathy and active listening, trying to understand the patient and family members' concerns and addressing them in a calm and respectful manner. I also involved the patient's healthcare team and social workers to provide additional support and resources as needed. By remaining patient and professional, we were able to work through the challenges and provide effective care for the patient. 22. How do you maintain your knowledge and skills in the nursing field? Answer: I maintain my knowledge and skills in the nursing field by staying up to date with the latest research and best practices, attending conferences and continuing education courses, and seeking feedback from my colleagues and supervisors. I also participate in peer review and quality improvement initiatives to identify areas for improvement and implement evidence-based practices to enhance patient outcomes. 23. Can you describe a time when you had to advocate for a patient's rights or needs? Answer: One example of advocating for a patient's rights or needs was when I cared for a patient who was experiencing significant pain but had a history of addiction and was hesitant to receive opioid medications. I advocated for the patient's right to pain management by consulting with the healthcare team and providing alternative options such as non-opioid analgesics and complementary therapies. I also ensured that the patient's pain was being appropriately assessed and monitored, and advocated for the patient's need for emotional support and communication throughout their care. 24. How do you handle conflicts or disagreements with colleagues or supervisors? Answer: I handle conflicts or disagreements with colleagues or supervisors by approaching the situation with respect and professionalism, and seeking to understand their perspective and concerns. I try to find common ground and work collaboratively to find a solution that is in the best interest of the patient and the team. If necessary, I seek guidance from my supervisor or use appropriate channels for addressing conflicts or grievances. 25. Can you describe a time when you had to communicate sensitive information to a patient or their family member? Answer: One example of communicating sensitive information to a patient or their family member was when I cared for a patient who was diagnosed with a terminal illness. I approached the situation with empathy and compassion, acknowledging the patient and family members' emotions and providing clear and honest information about the diagnosis, prognosis, and available treatment options. I also provided emotional support and resources for coping with the diagnosis and end-of-life care. 26. How do you ensure patient safety and prevent errors in your practice? Answer: I ensure patient safety and prevent errors in my practice by following best practices and adhering to established policies and procedures. I use critical thinking and clinical judgment to identify potential risks or hazards and take appropriate action to mitigate them. I also communicate effectively with my colleagues and healthcare team to ensure that we are all working together to provide safe and effective care for our patients. 27. Can you describe a time when you had to work with a culturally diverse patient population? Answer: One example of working with a culturally diverse patient population was when I cared for a patient who spoke a different language and had different cultural beliefs and practices than I did. I approached the situation with respect and openness, using interpretation services and cultural competency resources to bridge the communication and cultural gaps. I also took the time to learn about the patient's cultural background and preferences, and adapted my care accordingly to ensure that the patient's cultural needs were being met. 28. Can you describe a time when you had to manage a challenging patient situation, such as dealing with a combative or confused patient? Answer: One example of managing a challenging patient situation was when I cared for a patient who was agitated and confused due to their medical condition. I approached the situation with a calm and reassuring demeanor, using verbal de-escalation techniques and providing a safe and supportive environment for the patient. I also involved the healthcare team and used appropriate medications and restraint measures as needed to ensure the patient's safety and well-being. 29. How do you prioritize and manage your workload during a busy shift or when unexpected events occur? Answer: I prioritize and manage my workload during a busy shift or when unexpected events occur by using a systematic approach and delegating tasks appropriately. I prioritize tasks based on the patient's acuity and needs, and communicate effectively with my colleagues and healthcare team to ensure that we are all working together to provide timely and effective care. I also take breaks and practice self-care to maintain my physical and emotional well-being, which is important for providing safe and effective care to my patients. 30. Can you describe a time when you had to provide emotional support to a patient or their family member? Answer: One example of providing emotional support to a patient or their family member was when I cared for a patient who had experienced a significant loss or life change. I approached the situation with empathy and compassion, providing a listening ear and validating the patient and family member's emotions. I also provided resources for counseling and support services, and collaborated with the healthcare team to ensure that the patient's emotional needs were being met along with their medical needs. 31. Can you describe a time when you had to advocate for a patient's rights or needs? Answer: One example of advocating for a patient's rights or needs was when I cared for a patient who was not receiving adequate pain management. I approached the situation by communicating with the healthcare team and advocating for the patient's needs, using evidence-based practice and research to support my recommendations. I also involved the patient and their family in the decision-making process and provided education about their rights as a patient to receive adequate pain management. 32. How do you maintain your knowledge and skills as a nurse? Answer: I maintain my knowledge and skills as a nurse by staying current with best practices and evidence-based research, attending continuing education courses and conferences, and seeking out mentorship and guidance from more experienced nurses. I also participate in quality improvement projects and seek feedback from my colleagues and supervisors to identify areas for improvement and growth. 33. Can you describe a time when you had to handle a medical emergency? Answer: One example of handling a medical emergency was when I responded to a patient who was experiencing respiratory distress. I approached the situation by assessing the patient's airway, breathing, and circulation, and initiating appropriate interventions such as administering oxygen, calling for additional support, and preparing for possible intubation. I also communicated effectively with the healthcare team and provided emotional support to the patient and their family during the emergency situation. Thanks for watching this video. Any questions, comment below. Thank you all. If you like this video, like, comment and share to all. Thank you.